Hello and welcome back to the Stay Sure Wellbeing YouTube channel. I'm Dr. Dawn Harper and today I'd like to talk about the menopause. Now it may seem that that's a very girly thing for me to talk about, but actually a while back I did a telephone phone-in on a national radio station and I was surprised by the number of men that called in wondering how to help or trying to understand more about the menopause in their wives, girlfriends and partners. So I thought it might be useful for us to just talk a little bit about the menopause. Now, strictly speaking, menopause means the stopping of periods, and so medically you can only diagnose the menopause a year after a lady has stopped her periods altogether. But when we talk about the menopause, what we tend to talk about is that time around when the periods stop and often symptoms develop. The average age for the menopause in the UK is 51, but really you can go through a natural menopause anytime between 45 and 55. Between the ages of 40 and 45, if a lady goes through the menopause at that stage, we call that an early menopause. And if a lady goes through before the age of 40, that's referred to as a premature menopause. And it can run in families to go through an earlier change, so well worth finding out what the family history is. The youngest lady I've ever met who went through a natural menopause at 28 was actually trying to get pregnant, and we only discovered that she was postmenopausal when we were trying to look into her hormones and understand why she couldn't get pregnant. And when she went back through her family history, actually she had an incredibly strong family history of very young menopause. And she said, had she known, in those days, it was before IVF was available on the NHS, and she said had she known she might have decided to try for a family at a younger age. So certainly just worth knowing what your family history is like. Now, I'm sure if I went out into the streets and asked people about the symptoms of the menopause, most people would know about things like hot flushes, night sweats, maybe mood swings and sleep disturbances. In fact, 3 out of 4, around 75% of women in the UK will get symptoms associated with the menopause, and to be fair, those are the most common, but there are a myriad of other symptoms. Of course, 1 in 4 ladies will just stop their periods and sail through and not have a problem at all. But the menopause can cause all sorts of issues. I've met people who have lost all self-confidence, who become really emotionally unwell, very tearful, sometimes clinically depressed through the menopause. The hot flushes, the night sweats and the sleep disturbances can often lead to a low mood as well as the hormonal changes. But there are other things as well. Skin changes. Often ladies tell me that their skin feels much drier, or they'll get aches and pains. Joint pains in particular can be part of the menopause. So I think if you're of that age, if your periods are starting to play up and you're getting physical and emotional symptoms, the chances are you're menopausal. Now, women will often ask me if I will do a blood test to check their hormones. But when we get symptoms associated with the menopause, and in fact when we get symptoms associated with hormones, it's usually because our hormones are all over the place. They're not at a steady level. It's that change in hormone that affects our emotions and our moods, which is why women get antenatal and postnatal depression, why we get premenstrual syndrome or premenstrual tension, and why we get perimenopausal symptoms. So the issue with taking a blood test in a lady of say about 50 to look at her hormones is what the test that we use is something called a follicle stimulating hormone, or an FSH, and that is the hormone that drives the ovaries. Now, when we've gone through the menopause and we're the other side, then that hormone is very high because it's desperately trying to get ovaries that have failed to start working again. But as we're going through that perimenopausal stage, actually I could take a blood test from a lady like that every day for a week and get 7 completely different readings. So it's not that reliable, and certainly if a lady comes to me and she is between the ages of 45 and 55 with menopausal symptoms, then she's menopausal until proved otherwise, and we really need to look at what we can do to make things better for her as an individual and for those around her, because the menopause does affect friends, family, work colleagues. So really, if you think you're menopausal, what should you do? I think it's great that we are better at talking about the menopause today than we have been in generations before. I don't think my mum, for example, would have talked very much to her friends about it. I had a school reunion a couple of years back now, and we were all laughing about, it's the age of the layer, because it was hot one moment, cold another. And I know that I talk much more openly, and I don't think that's just because I'm a medic. I think actually it's just a slight change. We've still got a way to go, but I think talking is really important. Talk to your partners, talk to your friends, and if necessary, talk to your doctor. Way back, I guess, in the early 2000s, as the only female doctor at that point in a 7-partner practice, I couldn't do a GP surgery without seeing a lady who wanted to talk about whether or not she should consider HRT. And of course, then we had the Million Women study and some very scary headlines. And overnight, women stopped coming in to have those conversations, which I think is really sad, actually, because menopause is not HRT or nothing. I've already told you that around 3/4 of women will get symptoms, and those symptoms are hugely variable. It can be anything from the occasional flush, which actually you can just live with, to some poor women who will get really devastating flushes every few minutes all throughout the day and night, and it just ruins their lives. People often ask me how long that's going to go on for, and of course we don't have a crystal ball. It can be anything from a few months to several years. But sadly, with all those headlines, I stopped seeing women, and I know a lot of women really struggled physically and mentally with the menopause because they were too scared to even have a conversation about HRT. The pendulum is starting to swing back, and I am starting to have more of those conversations. That's a really good thing. It's not HRT or nothing. And actually, HRT isn't just one thing. There are something like 70 different formulations of HRT. And that's because even if you decide to go down the HRT route, it's not a one-size-fits-all. It's a little bit like choosing the little black dress. That's the way I describe it to my patients. So what might look great on you just isn't really going to work on me, or vice versa. And so it's my job as a doctor to try and fine-tune the form of HRT, if that's the route we decide to go down, to suit the lady. And of course today we do know there are genuine risks associated with, especially with longer term HRT, and we have to take that into account, and it's a balancing act. It's a kind of risk reward. So I tend to use the lowest dose that I can get away with for usually a very short period of time, a few months, 6 months let's say, but maybe I have some ladies who really desperately want to be on it for longer, and as long as we both know the risks and the benefits, and that is an informed decision, then that's very much an individual decision that we can make together. So what I think I'd say to you is don't rule out HRT, but as I've already said, it's not HRT or nothing. Exercise is great. I'm afraid we're all far too politically correct today to talk about middle-age spread. But it's just because we don't talk about it doesn't mean to say it doesn't happen. It does. Our metabolism changes. We tend to put on weight more easily. We lose muscle mass and gain fat. And that fat tends to, as a general rule, tends to go on around our midriff. So really important that you exercise regularly, and actually that you also do some weight bearing or strengthening exercises. I'm a great fan of aerobic exercise. I love walking and I love cycling mostly, but I've increased my walking and I've also incorporated some strengthening exercises because we know that after the menopause, ladies' bones thin and we're at risk of what we call brittle bone disease or osteoporosis. So important that you do some regular exercise for both your physical and mental health. So you need to look after your bones, your heart and your mental health, and exercising a little bit every day will do just that for you. It's also important that we eat well, and just remember that your metabolism will slow down, so you may need to cut back a little bit on what you are eating. Now, interestingly, I am told that there is no such word in the Japanese language as hot flush. There's no direct translation. And the thinking behind that is, whilst I've told you that 75% of British women will get symptoms, the most common being those flushes and sweats, actually it's not so common at all in Japanese women. And it is thought that that's due to their high soya or phytoestrogen intake. So there are certain dietary things that we could think about, and there are herbal remedies that you may want to consider. If you're going to have a herbal remedy, I would say try it for 3 months, give it a chance to work and stick with one formulation, and try to opt for a regulated product. Because herbal remedies are classified as food supplements, they are not so strictly regulated as medicines. So important that you just check that you've got a regulated product. Have a look in the box, and if there's a patient information leaflet, that usually means that that product has been properly licensed, and so you know that you are taking what you think you're taking. I think it's also really important, it's a very important time in your life to take some time out, what I call me time. Sometimes I think women feel very guilty about me time, and particularly I think in my generation now, quite often, a lot of my friends I talk to might still have young people living at home, and they may also be starting to need to look after elderly relatives and be a little bit more involved with that, and sometimes you can be sandwiched between all of that and stretched a little bit thin. I think it's really important that you take some time out, whether it's a yoga class, a bit of a relaxation, something like that. Really good for your mental health, and don't feel guilty about it. It will make you a better mum, a better daughter, a better friend, a better work colleague. It's really important that you take some time out to get off of that hamster wheel and that you look after your own health. It's also a time to make sure that you prioritise your healthcare assessment. So if you're invited for a health check or a mammogram or a smear, please go. I know you might still be trying to work and juggle home and family and everything, and often those letters kind of fall to the bottom of the list, but really important that you go for those assessments. And as I've said, just talk, please talk. The talking therapies, things like cognitive behavioural therapy, and there are some great online CBT courses, can really help you if you're struggling emotionally through the menopause. But talking is so important. Explain things to those around you, to your friends and family. And if you think you need extra help, my plea would be, please do speak to your doctor. You won't be forced into HRT. It is very much a two-way conversation. And just a little backstory, and just a little tip for you. When you speak to your surgery, it may be that you have a doctor that you see most of the time with another condition, but we are all generalists in general practice, and often within a surgery there will be one doctor, and it isn't necessarily the female doctor, who has a special interest in menopausal type things. And it is worth asking the receptionist who that doctor is in your surgery. You may have to wait a little longer to talk to that person, but if you want to have a really good in-depth conversation about whether or not HRT is right for you, it is worth trying to speak to the person who has the most knowledge in that area of medicine. So that's just my little sort of tip from behind the scenes. Anyway, I hope that's helped. If you have questions related to this, you'd like me to do another session, I really would love to just, a Q&A, whatever you want to do. We want this to be really useful for you. So I hope you stay fit and well. I hope that your menopause is not too tricky. I know it can be a real challenge for a lot of women, but my last plea to you is, if you're struggling, please make that appointment and have that conversation with your doctor. So that's it, I think, today for the menopause. I will be back very shortly, and of course, as always, if there are things that you'd like me to talk about, please do message me here or email me anonymously on the website so that I can answer your questions about the health concerns that you have. But until then, stay well.